is Brendan McSherry, and I'm an oncology nurse. So I'd been in and out of therapy for about 10 years, and most people were just diagnosing me with just having some severe depression, and then I would come out of the depression and they thought I was okay. It wasn't until I met a psychologist when I was about 23 years old who recognized that when I was coming out of those depressions, sometimes I was going up, and that he was recognizing that it was bipolar disorder, not just some severe depressions. And I remember I left his office and I was stunned, even though it was something that I knew, but hearing it out loud, it's not real till they tell you. And I remember I left his office and I went right to the library and I read through about 3 or 4 books in the span of about 2 or 3 hours, and I was like, well, maybe there is something to this. It was tough at first. The first couple weeks it was just very difficult because we started using some pharmacological therapy. Again, it was frustrating because they start you so low and try to work your way up to when it becomes therapeutic, but the problem is that sometimes these antidepressants or mood stabilizers can take 4 to 6 weeks to work. So right off the bat they started me off too low, and then they bumped me up high right as it started kicking in. So I went from depressed to manic. It just shot me right up. And then they had to try to cap that and keep me in that level. So once we got the medication straightened out, it did become easier. Overall, it was a tough journey. It's still something that I battle with even to this day. I know it sounds easy to just say, yeah, take your medicine, you'll be fine, and it should be that easy, but stick to your treatment plan. It's very difficult to, and I know that sounds very strange, but it is really hard because you do miss those highs, and as on a strange note, you do miss the lows too. As horrible as they are, there's a strange addictive quality about it. I think maybe it's the uniqueness that you feel that you're the only person that's feeling this in the world, and somehow that makes it special, but it's a horrible place to be in, and you have to recognize that treatment will get you out of there and that you have to stay on your treatment, because if you follow the treatment plans and you put the effort in, you will reap the benefits of it. It will get better. Every depression that I've been in has been shorter than the one before it, and I think that that's a good sign. It may not ever get completely rid of, but it will always get better if you put in the effort, because you are okay.